Hello, good morning students. Probably you have seen my previous video on boundaries of thoracic inlet and it is known to you already. Again I am showing you the boundary very shortly, and this is the thoracic inlet or also called superior thoracic aperture. This is the vertebra, first thoracic vertebra. This is manubrium sternum and this is first costal cartilage of both sides and the first rib. So this is the boundary of thoracic inlet. You know this thing. And this is the transverse diameter and this is anteroposterior diameter. This diameter is double of this anteroposterior diameter. And you see in this way, this is bean sepate or kidney sepate. This one. I will today show you what are the structures which are entering from the neck to the thoracic cavity, or some structures from the thoracic cavity to the root of the neck like this. So this inlet is at the junction of root of the neck and the thoracic cavity. Just you look at the other specimen. This is the thoracic cage. This one thoracic cavity, and cage is formed by the sternum in the midline, on either side the ribs, and posteriorly the thoracic vertebra. So this thoracic cage contains the different structures of thoracic cavity like heart, lung, and so many blood vessels, lymph nodes, lymphatics, etc., etc. They are all inside the thoracic cavity. And in the thoracic cavity, you know the lungs on each side, and in the middle is the heart. This is the main content of the thoracic cavity. Though there are so many nerves, veins, arteries are there, but these three, two lungs and heart in the middle, is the main or largest contents or larger contents of the thoracic cavity. And this is the structure on the posterior wall of the thoracic cavity, which lies in front of the vertebra. Can you see? Is the vertebral body. In front of it, this one in front is a trachea. This is trachea, and behind it and in front of the thoracic vertebral body is the esophagus. So esophagus behind and trachea in front. In between these two, there is a groove called tracheoesophageal groove. In this groove, you can see or you can find one nerve, that is recurrent laryngeal nerve. So when I will draw the structures at the inlet on the posterior side or on the vertebral side here, I will draw the esophagus here and in front of it trachea. These two. And if I show you this one, just by rotating this head on the back side so that you can see the structures. The thoracic case, it is full of the structures, lung of both sides, and in the middle is the heart. Here is the diaphragm is there, which is called the inferior boundary of the thoracic cavity. Also, it is called as the lower thoracic aperture or inferior thoracic aperture, which is closed by the dome-shaped diaphragm like this. And above it thoracic cavity, and here is the thoracic inlet. This one, thoracic inlet. These two chalks are given here for one esophagus, one for the trachea, one in front and one in back. That I already have shown you in the specimen of the trachea and esophagus like this. One is esophagus in front of the vertebral body and one is trachea in front of the esophagus. So I remove this. Now you see. Probably you can see the structures which are coming out or going inside the thoracic cavity through this inlet. And this is the lung of this side, this is the lung of this side. Only the apical part of the both lungs you can see, which are coming out beyond the first rib. So that apical part of the both lungs will be the part of the content of the thoracic inlet. And in between these two lungs there is a heart. And from the heart, you know, the main artery which is coming out from the heart is the ascending aorta, and then it becomes arch of the aorta. From the arch of the aorta, there are three main branches are there. Arch of the aorta, it is in the thoracic cavity. It is not, it is the content of the thoracic inlet. But the branches which are arising from the thoracic aortic arch, that will be the content or will be passing through the thoracic inlet and going into the neck. And these three structures are brachiocephalic trunk, and in the middle it is a left common carotid artery, and on the left side it is left subclavian artery. So if you cut at this level, you will get three structures. There is one is brachiocephalic trunk, one left common carotid artery, and one left subclavian artery. Besides this, you will find some veins are there also, because from the head neck region, one vein is coming downwards as internal jugular vein, and one vein from the upper limb, that is called subclavian vein. These two veins join together to form the brachiocephalic vein of right side. Similarly, on the left side, you will get the left brachiocephalic veins. So the brachiocephalic vein you will find at the level of the thoracic inlet, because these two veins enter into the thoracic cavity, and behind the first costal cartilage, they will form the superior vena cava. So superior vena cava is a part of the thoracic cavity, but at the level of thoracic inlet, you will get the brachiocephalic vein of right side and left side. And beside this vein, you may get other veins or other nerves or some lymphatics. These nerves are on the posterior thoracic wall. On each side of the vertebral body, there are two sympathetic trunks or sympathetic chain with sympathetic ganglia. And in front of it, in between the lung and heart, there is another important nerve that is called a vagus nerve. And anteriorly to the vagus nerve, there is another nerve that is called phrenic nerve. So phrenic, vagus, and sympathetic trunk from anterior to posterior in between the lung and the heart at this level of thoracic inlet. And thoracic duct, which is again the important lymphatic channel, which at the level of sternal angle, it arches from the right to the left side. So when you cut at this level of thoracic inlet, you may find the thoracic duct on the left side, because it ends or drains at the junction of internal jugular vein and the subclavian vein of the left side, not right side. Besides these arteries, vein, nerves, etc., you may get some muscles which are arising from the sternum. So just behind the sternum, on the posterior surface of the manubrium sternum, you will find the attachment of sternothyroid and sternohyoid muscle just behind it. And another important feature also there, level of thoracic inlet, there is the thymus. The thymus also important structure you may get. So overall, or in summary, I can tell you what are the structures at the level of thoracic inlet. You will classify this way: muscles, then vessels like arteries, then veins, then lymphatic vessels, and thirdly the nerves. The nerves, vagus nerve, phrenic nerve, and sympathetic trunk. If I draw and like this, drawing a cross section at the level of thoracic inlet, it looks like this. Suppose this is sternum, this is the manubrium end of the sternum, this is the anterior side, and posteriorly is the vertebral body. This is the T1 vertebra, this is transverse, this is the pedicle, this is lamina, this is spine, and this is transverse process of first thoracic vertebra. And on either side, here is the first rib like this, is the first rib like this. So this is the cross section at the level of thoracic inlet. This is the sternum or manubrium sternum, T1, and this is the ribs, and this level is the costal cartilage. At this level is the costal cartilage of both sides. Now I will show you the contents of the thoracic inlet. So it is the posterior side, is the first thoracic vertebra, and in front of it there is one tubular structure, it is called esophagus. This is esophagus, just in front of the vertebral body. In front of the vertebral body, esophagus, and in front of the esophagus there is another tubular structure, that is the trachea, and in between these two and toward the left side there is one nerve in the tracheoesophageal group, that is left recurrent laryngeal nerve. In between these two, this one, left recurrent laryngeal nerve. Anteriorly, if I go anterior side, here you will get two important muscles arising from the sternum, sternothyroid and sternohyoid. Anteriorly, just behind it, important vessels are there. One right side, one left side, called brachiocephalic vein. Brachiocephalic vein and also brachiocephalic vein. And artery, the three important arteries which are the branches from the arch of the aorta. It is a brachiocephalic trunk or brachiocephalic artery. It is left common carotid artery. It is a left subclavian artery. From the left subclavian artery, also from the right subclavian artery, one artery arises that is called internal thoracic artery or internal mammary artery, which descends downwards on either side of the sternum. That artery you may get at the level of this thoracic inlet. And important nerves. There is one vagus nerve, one phrenic nerve on both sides. And here is the lung of this side and the lung of this side. This is lung. So this is in front phrenic and behind vagus. Besides these two important nerves, another nerve in front of the vertebral body on either side called sympathetic chain or sympathetic trunk on both sides. This one also. One right, one left. And another important structure that is called thoracic duct. That is thoracic duct, which arches at the level of sternal angle from right to left to drain into the junction of internal jugular vein and subclavian vein. So on and whole, you see the different structures at the level of thoracic inlet. If I tell you in summary, from anterior to posterior, that is sternothyroid, sternohyoid, brachiocephalic vein right and left, then brachiocephalic trunk, left common carotid artery, left subclavian artery, internal thoracic artery of right side and left side, vagus nerve, phrenic nerve, right and left. This nerve starting from the neck descend downwards to supply the diaphragm. So it should cross the thoracic inlet. And also vagus nerve, it supplies the structures in the thorax as well as in the abdomen. So it should cross the thoracic inlet to enter into the thoracic cavity and then into the abdominal cavity. So that also you will get in this thoracic inlet level. And this sympathetic chain, it starts in the cervical region, neck region, descends downwards on either side of the vertebral body to reach into the thorax, then abdomen, and ends as ganglionic impulse in front of the coccyx. So this sympathetic chain also should cross the thoracic inlet. So all these structures you will get. But of these all structures, some structures, they pass from root of the neck to the thorax, and some structure from the thorax to the neck, like the arteries. They pass from the thoracic cavity towards the neck. But these veins that enter into this thoracic duct, they from the abdomen, then like this. Through thoracic inlet, then it ends at the internal jugular and subclavian vein junction. But phrenic nerve, vagus nerve, sympathetic trunk, they descends downwards to enter thoracic cavity. So from this, you will understand that the thoracic inlet, it is not a completely inlet, it may be called as an outlet in clinical term, or better to say the superior thoracic aperture through which some structures may enter or into thoracic cavity and some structures may goes out of the thoracic cavity through this aperture. So better to use. So many anatomists use this term superior thoracic aperture instead of thoracic inlet. But what is the importance of knowing all these things? The contents of thoracic inlet. Because if there is any tumor or some swelling in the apical part of the lung, that may compress on these structures. They compress the veins, compress the artery or the nerves. So because of compression, there may be different or various symptoms or consequences. If it compresses the veins drains the head neck region and also upper extremity. So if the vein is compressed, the blood flow or venous blood flow from this head neck region, from the upper limb will be hampered. So there is stagnation of blood in the superior extremity and head neck region. Because of this stagnation, due to obstruction of this vein, there will be swelling of the upper limb, which is called edema. of the upper lip, and veins also will be engorged. If it compresses the subclavian artery, the subclavian artery is continued as the brachial artery, then radial artery. So there may be the absence of radial pulse. If it compresses the phrenic nerve, this nerve, it supplies the diaphragm. So diaphragm may be paralyzed of that side. Other side will remain intact if it is not affected by the opposite sided lung tumor or like that, any compression by the lung or from lymph node or any other structure. So this is the importance to know what are the structures pass through the inlet and what is the consequences because of the obstruction. Of these signs and symptoms because of obstruction at the level of thoracic inlet is commonly termed as thoracic inlet syndrome or superior thoracic aperture syndrome. Suppose trachea may be involved. If trachea is involved, laryngeal nerve is involved, there will be hoarseness of voice. So a different symptom due to the structure affected by the swelling or by the tumor which is pressing or affecting the structure. Accordingly, there may be various symptoms. So as a whole, all these symptoms together, they are called the thoracic inlet syndrome. So I think this is all for today. Next day I discuss on another topic, maybe your superior inferior thoracic aperture or diaphragm, or maybe other topic you like. If you like this video, you please press on the like button and share it to your friends, and of course don't forget to subscribe this channel for the next video. So thank you very much for today. If you like this video, click on the like button and share it to your friends, and of course subscribe it. Thank you.